The health insurance industry is navigating a perfect storm: rising healthcare costs, surging patient demand, and scrutiny from lawmakers. Perfect storm. As we open 2025, the question isn't if disruption will strike, but how deeply its ripples will be felt. Medicare Advantage, once the crown jewel of insurer profitability, is showing cracks under the pressure of mounting utilization and shifting policies. Industry giants like Humana and UnitedHealth are grappling with challenges that could redefine managed care as we know it. But here's the thing: uncertainty breeds opportunity. And if you're an entrepreneur or a healthcare provider, you're going to want to stay tuned to this episode. I'm Alex Yarijanian, and on today's episode of the Value-Based Care Advisory podcast, we'll uncover the forces driving these changes, reveal opportunities hidden in the chaos, and share actionable strategies to help you navigate through this uncertain time and evolving landscape.
Listen close, I got a deal to share. Healthcare changing with a mighty flare. Value-based care on the rise. Breaking chains, lifting high the skies.
The health insurance industry is entering uncharted territory. Reporting from Anjali Kamlani at Yahoo Finance highlights a sobering reality. Insurers are ending 2024 on a low note and aren't starting 2025 much higher. With Congress aiming to rein in costs and increase utilization squeezing these profits, the stakes for 2025 really couldn't be much higher. You all remember during COVID, utilization dropped significantly. But now the pendulum has swung back. Deferred procedures and postponed care have created a surge in claims. For example, imagine a senior who delayed knee replacement surgery in 2020. Now that same senior patient is back in the system. They require more intensive care, and it's at a higher cost. This trend is upending financial models across the board. Morgan Stanley's recent analysis adds perspective here. Managed care stocks underperformed quite significantly in 2024. Again, Morgan Stanley cites policy headwinds, higher utilization, industry scrutiny as factors that caused underperformance of these stocks. Humana, the largest Medicare Advantage provider, has been particularly hard hit. No surprise there, since its reliance on Medicare Advantage for 30% of its insurance revenues underscores just how vulnerable even some of these strongest players can be. So what is the core issue here? Let's first look at Medicare Advantage. At its core, Medicare Advantage plans offer additional perks like Humana's Silver Sneakers Gym program, such perks that traditional Medicare doesn't offer. Over the past 5 years, Medicare Advantage enrollment has grown from 30% to now nearly 50% of eligible seniors. That's a huge jump. For insurers, this has been a golden ticket, and it's been driven by aging population and increased government funding. But here's the catch. It's expensive. It's expensive. Studies show that Medicare pays $300 more per enrollee in Medicare Advantage plans than for traditional Medicare. That's $300 per enrollee annually, which adds up fast across millions of members. And when utilization spikes, as it has recently, insurers are left holding the bag. Now, there's another layer to this story. Patients often switch from Medicare Advantage back to traditional Medicare, where their healthcare costs become more complex, when their healthcare needs become more complex. These high utilizers go from Medicare Advantage back to traditional Medicare. So these high utilizers increase costs across the board, creating what I call a double whammy. MA plans lose revenue, and the broader system absorbs higher costs. Now let's talk about numbers. Let's talk numbers because they tell a compelling story. The key metric here is what's called the medical loss ratio, or MLR for short. This ratio represents how much insurers spend on medical care versus how much they collect in premiums. By regulation, by law, insurers must spend at least 80 to 85% of premium dollars on care. Anything above that 80 to 85% cuts directly into their profits. Think of it like this. For every dollar insurers collect, 85 cents must go to healthcare costs by law. But if they spend more than that, their profits start to shrink because anything over that 85%, they could get to potentially keep, right? If they don't spend on medical care. For example, Humana's MLR jumped from 86% in 2022 to nearly 90% in 2024. Aetna CVS, another major player, reported a staggering 95.2% medical loss ratio in Q3 of 2024. These trends show how rising utilization is squeezing insurers' margins and forcing them to rethink their strategies. Okay. Over the past decade, we've seen health insurance revenues really skyrocket. For instance, look at UnitedHealth Group, who reported $372 billion in revenues in 2023 compared to $123 billion in 2013. But profit margins haven't kept pace. That's their pain point. Despite growth, managing costs for each new member has kept margins razor thin. And these companies are huge. To conceptualize just how big they are, here is Dan Diamond, national reporter for the Washington Post, teeing it up for us.
They're owned by UnitedHealth, which has its fingers all over healthcare right now. And that is something that government officials that I've talked to this week have been thinking about as well. There is an antitrust probe into United through the Justice Department preceded this, but there is a real question about what are the risks if so much of healthcare is concentrated in just a few hands.
The policy environment is adding fuel to the fire. From owning the largest network of doctors to controlling pharmacy benefits, UnitedHealth's sprawling influence is under the microscope. Add to that the Justice Department's ongoing antitrust probe, and it's clear the industry is at an inflection point. Senator Elizabeth Warren, during a Senate Finance Committee hearing mid-2024, questioned UnitedHealth Group's practices, highlighting antitrust concerns and the company's dominance across healthcare verticals.
Because UnitedHealth has bought up every link in the healthcare chain, you are now in a position to jack up prices, squeeze competitors, hide revenues, and pressure doctors to put profits ahead of patients. UnitedHealth is a monopoly on steroids. The opportunities for price gouging are everywhere. For example, UnitedHealth is the biggest participant in Medicare Advantage, the government program that pays private insurers to administer Medicare benefits.
And here is Senator Tom Tillis, during the same Senate Finance Committee hearing, addressing the CEO of UnitedHealth Group while pulling out a book on hacking for dummies as he's grilling the UnitedHealth Group CEO on the Change Healthcare hack. Listen to this.
Well, I actually brought in, I used to bring this to when I was on Senate Armed Services. I had to give up Senate Armed Services to get on finance, but I always brought this book in when we had cyber attacks. It's called Hacking for Dummies. This is the 5th edition. It doesn't include the nature of the breach that you all developed, but this is some basic stuff that was missed. So shame on internal audit, external audit, and your systems folks tasked with redundancy. They're not doing their job. And as a result, we have a data breach where I've said in Judiciary Committee, this is the first meeting I've had where we're talking about data privacy, data breach since I've been on finance. But I really do believe it's your problem to fix, and the damage to the consumer's data is you got to keep them whole. That enterprise, your entire enterprise is based on the movement of data, movement and exchange of data. That's how you create value. My health records, the health records of people that are moving. So when you have a breach, it's got to be your problem, not my problem.
Then there's the Trump administration's potential policy shifts, which could upend the Affordable Care Act while maintaining support for Medicare Advantage. This resulting uncertainty will ripple through every aspect of the insurance landscape. Mark my words, every aspect of the insurance landscape. But with uncertainty comes opportunity. Now, earlier in this episode, I hinted that healthcare providers and entrepreneurs should be particularly tuned into this discussion here. So for healthcare providers, question, Have you evaluated your patient population to identify high-cost areas where you can make a difference? Have you thought about approaching health plans, with a concrete proposal that shows how you can reduce costs while improving outcomes? For entrepreneurs, what innovative solution can you offer to reduce waste and improve care quality? I encourage entrepreneurs to think about something beyond technology. Start thinking beyond technology to process improvement and/or partnerships. What small think through this. What small changes in care delivery could significantly lower costs? If you're a healthcare provider, now is the time to engage your health plan partners. Now is the time. Start conversations about value-based care and explore risk-sharing agreements. Position yourself as a solution to their rising MLR problem by doing the following 3 things. Step 1, analyze your population. Identify high-cost, high-need patients and craft care pathways that address their specific needs. 2, propose innovative contracts. Advocate for shared savings, risk adjustments, and quality incentives in your agreement so that you can make sure you're picking up some of those dollars you're saving the health plan. 3, demonstrate ROI. Show how your approach can provide a return on investment by reducing costs while improving outcomes. For entrepreneurs, this moment is ripe for innovation. Gaps in the insurance market, particularly in technologies aimed at reducing medical loss ratio, are prime targets. Think about AI tools for predictive analytics, streamlined care management platforms, or solutions that enhance transparency and efficacy in claims processing, not to mention efficiency. For example, in 2021, a small startup partnered with a regional health plan to launch a remote patient monitoring solution, reducing MLR by 5%. That's a golden nugget. The healthcare system is standing on the edge of transformation. Rising costs, surging patient need, and policy pressures are reshaping the industry. As we get into full swing of 2025, the question isn't just how we'll navigate these changes, but who will rise to lead them. As the healthcare landscape evolves, proactive adaptation will separate those who thrive from those who merely survive. And whether you're a healthcare provider, a payer, or an innovator, the decisions you make today will define the future of healthcare for years to come. So congratulations. I'm Alex Yarijanian, and this has been the Value-Based Care Advisory Podcast. We don't just report on the changes in healthcare. We challenge you to think differently, act boldly, and lead with purpose. Until next time, stay sharp, stay informed, and stay ready.
Your care, your life, let's make it ideal. Oh yeah. VBCA, it's all surreal. Your health journey, let's seal the